You think of these offices, they have removable partial RPDs, full denture cases, and failing dentition. It's surprising how many people are qualified that our staff are just missing. So that's the first thing, identifying those who are eligible.
I want to educate the doctors so they can speak on it, because as you move away from the border, you start to see less and less dental tourism, but you still see it, right? So what are some horror stories that you've seen around that?
It's unfortunate. The cases that we see, and again, they're not every case because are some successes out there. We just don't see them. But the failures we see are usually catastrophic. It's both the restorative component and one or multiple implants.
Welcome back to another episode of the full-ach Advantage podcast. I'm your host, Gary Bird. I'm the founder of SMC National, where we help you create, convert, and close more full-arch cases so you can grow the way that you want. And today, I have a special guest, Dr. Brian Evans, who serves as an oral surgeon at SD Oral Facial and Implant Surgery, and he's going to break down how to select a mentor when you're in full arch, how he did it and how he works with other dentists. And this is going to bring a ton of value to you, especially if you're trying to grow right now. He's also going to talk about what it's like working in San Diego, where he gets a ton of cases of people coming back from Mexico with messed up implants. Stay tuned. All right, we are live, and I'm excited about this one. I actually met Dr. Brian Evans at our event in San Diego, which is right down the street from his office. And Dr. Sharafi, one of the doctors that he works with, actually spoke at the event, and it was great having you there, Brian. And I'm excited to talk with you today. And I know you guys do a ton of full arch in your guys' practice, and I would love to hear straight from you. What are you seeing that's helping dentists out there drive up their full arch cases?
Man, that's a great question, and I appreciate being on today. And man, that course that you had, Dr. Shrapi speaking, Stacy was there, a handful of other people. Man, what a good course. And I'm just going to tell you right now, I loved what you guys had to say about marketing, about the mindset, creating the dream, the passion, and then really helping the patients understand the value in what we're doing. Now, how does that relate to what we're doing? Well, it runs right in line with that. So we kind of have a couple different modes of acquiring patients. We have the organic referral mode, where we're going out, meeting with our dentists, and then we have the marketing side of things, where it's not as predictable as closing rates are a little bit lower with the marketing, things like that. But I love focusing on my relationship with the organic referrals. Mm-hmm. Mostly the dentists that aren't doing full arch in their practices. They know about it. They see people around them doing it, but they just haven't made that leap or haven't been able to figure out how to implement it in their office. And so that's one of the things our office specializes in, because we are a one-stop shop also and a full arch center. We can go start to finish. We don't have issue with that, but we much rather bring on restorative docs. And so we spent a lot of time the last 3-4 years working on that, step-by-step process to go from zero to complete restorations for these dentists and everything in between. So it's been fun training dentists that have never done it before, having them in office, watching how we do the certain things, and then letting them kind of pick and choose where they want to step in and go from there. So
that's so awesome. Now let's do this. I want to play a little game with you. Let's pretend you're a brand new dentist. You're out here and you're just getting into full arch, right? Okay. How would they begin to build out referrals, or would you not recommend they start that way?
Man, it's tough because it's such a risk reward procedure. Mm-hmm. Unless they're already, into surgical skill and technique and can do things themselves or have restored anything like this, you really need a big brother, big sister to do it with you. A lot of the weekend courses are great. You get a lot of the skills, but you need a surgeon or a restorative doc that had done it. You'd go into their office, figure out the different steps that they do, what you want to do in your office, and then try to implement that. I would always recommend doing your first 10, 15, 20 cases with a mentor. Just because the complication risk can be so high and catastrophic, because it's a high value procedure. I would have a mentor the first 10, 20 cases before I would do anything on their own.
So let's walk through that, the clinical side of mentorship. Are you talking about, so you go to the course, right? Hey, got an important announcement for you. We are hosting the second annual Full Arch Advantage event where you learn to create, convert, and close more full arches so your office can grow the way that you want. This is going to be in partnership with BioHorizons, and this is our second year, but the important part is it's going to be virtual, so you don't have to fly out, buy hotels, travel with your team. You can just register and block off the days and watch virtually. And right now we have early bird pricing. It's never going to be cheaper than right now. I don't even have a discount code because it's so cheap. It's only $199 right now to register, and it's for your team. It's for your dentists, it's for your treatment coordinators, your dental assistants, and your marketing managers. And you're going to learn a ton of stuff to grow. Last year's event had a 74 NPS score, which is amazing. And the feedback was really, really good. So if you're looking at leveling up, we have a ton of new content, a ton of new automations and things that you can add to your practice to really grow. And we're going to be going over a lot around sales and executing on the phones to make sure that you can grow the way that you want. So don't miss this. Go to Full Arch Advantage right now and sign up. This price will not be around for long. So you're a dentist, you learn general dentistry, you've done implants before, but then you go to a course for Full Arch. Does mentorship come after that?
Yes. Okay. 100% is what I recommend. Now, and I say that from the point where here in our office, between Dr. Shrafi and I, we've done, I think, 5,500 arches. We've done a couple. And not only that, in Southern California and San Diego, we see a lot of the complications, either from the general dentist, periodontist, Mexico, and even some of the oral surgeons in our own town refer to us to fix different things. And so a lot of the complications we see can be avoided with some pretty easily learned surgical techniques that if you're not seeing it and doing it on live patients, you just don't pick up on a weekend course. Yeah, you're going to miss it. And the biggest failure I see is not necessarily a case failure, but a doctor that doesn't have confidence, a couple of hiccups, they can't manage it. And then they just step away from full arch and go back to drill and fill, crown and bridge, which is sad.
Yeah. So what is so how does mentorship work? Like, let's say there's a doctor out there, like, how does it work? How do I find somebody? What's the cost associated with it? What are things I need? Yeah. How does that work from your point of view? I know everybody does it differently. And I would just love, because you guys are awesome at not just doing full arch, but I know you guys do, for the people who do full arch, you guys do the complicated cases for them. Does that make sense? Like, yes. You guys are like the G.I. Joe of full arch, right?
We have a number of full arch docs in San Diego that will send part of their cases over to us, which is fine. So a doctor that's interested in doing it, first finding the case, making sure they understand the indications for that. And one of the things we do is we'll go out to our general dental offices that are referring to us, and I host lunch and learns. I have a presentation that say, hey, for you, your hygienist, your staff, these are indications to look for. This is what a full arch patient looks like.
So just first is just like being able to identify who are the opportunities or who are the people that are qualified to be able to do full arch, and just training your team around that.
Right. And you think of these offices, they have removable partial RPDs, full denture cases, and failing dentition. It's surprising how many people are qualified that our staff are just missing. So that's the first thing, identifying those who are eligible. After that, we work with them about verbiage that they'll share with or the conversation they have with the patients prior to sending them over for a consultation in our office. So we have a arch coordinator who works with the office managers and coordinators at the other offices about key points to share or to say with them, and then they'll refer the patient over to our office. We really work hard to try to get that referral and that consultation done within 1 week. As you know, there's so many different things online, so many advertisements. They Google full arch once, that patient could be gone. It's game over.
Yeah. So most people, if you don't know this, because a lot of dentists don't understand this, they do see some of the ads, but they're not, dentists aren't served the ads the same way the patients are, because a patient never searched for a dentist. And then all of a sudden they're searching, where dentists are searching every single day for work. They're searching implant parts. They're emailing, and Google reads that, and they serve them ads based off of that. Like, there's so much going on there on a dentist computer. So just for the dentists out there that don't understand this, when a patient hits online and hits full arch, and they're in the demographic of that area where the any office wants to reach them, they're being served ads everywhere instantly by probably 50, maybe more offices, like boom, on social. When they go to social media now, it's all on their social media. So yeah, that's 100% true.
Yeah. And the other thing that's frustrating with that is they'll get prices and they'll get like one like teeth in a day, you know, $12.99 for this, that, and the other. And in reality, those
or
aren't
single.
actual
Here's the
costs.
worst one that confuses everybody: single implant, $99.
Yeah.
And it's like, well, what is that? The patient has no idea that doesn't account the abutment. It doesn't count the bone grafting. It's not like it's going to end up being more once you're all done with it, but you just got the tip of the iceberg for implant.
Well, and one of the things I heard recently from a conference, they said that just those flash ads, the online social media ads, that's the Spirit Airlines of full-arch. Cool, go there. I mean, and nothing against Spirit. It's what some people want, what some people need. But for someone looking to spend and invest in their smile, their mouth, their implants for long-term, 10, 20, 30, 40 years down the road.
If you've ever had to fly Spirit, though, you really understand this, right? Like I've had to fly Spirit before because like a plane got canceled and I wanted to get home. You too, right?
Yeah.
It's bad, right?
It's a different experience. It's a different experience. So we try to get the patients in the office as quickly as possible. We do the consultation, we book them for surgery. All that aside, the surgical and the prep there. But for the general dentist, if they're not comfortable and if they don't know how to restore these cases yet, then they do everything with us. So they'll come, they'll be here the day of surgery. They get to watch the surgery. Some of the surgical technique, the placement of the implants, what guides the placement of the implants, restorability, the whole works. From there, they're part of our follow-up. They know what to look for with implant integration, soft tissue healing, some of the instructions we give patients to ensure proper healing. And then the whole transition from the temporary prosthesis to the final prosthesis, whether it's a digital workflow, because we have that option. We have an in-house lab, an amazing lab tech that we have that's ours here. So we do a lot of analog stuff. So we'll do the old school wax ups, we'll do wax try-ins, and we'll bring the dentist in to help them identify some of the key aesthetics that you're looking for in full arch, as well as the functional aspect to not overload some of these implants to have a successful final restoration. But we do that with the dentist as many times as they need to. And so I've got a handful of my close friends that we've done 15, 20 cases together now, and they're here for every step of the way. They want to be here for the wax try-in. They want to do this. They want to do that. And then we allow them as part of our incentive program down here. They deliver the finals, and then they will do the maintenance for the first couple of years. But by having them deliver the finals, we're still able to make this very financially beneficial to the GP who sends us the case. And then we do pretty much everything with them, and then we let them deliver. So it's hands-on and it's hand-holding as much as they need. And then I got others that will come, they'll watch the process twice, 3 times. They're like, I like this. I think I can do the digital workflow, which we also work with some labs on. Let me do the digital workflow. Can I lean on you guys? I'm like, absolutely, lean on us. Because one of the things that at least I know our office, we pride ourselves in, because we have so many organic referrals that aren't just the marketing, we're invested in these patients. It's not just the surgery and go. I mean, we know that these patients are local, and we're going to see them for the next 20 years. And especially myself, Dr. Shrafi may only have 10 more years of practice.
Yeah, but you're going to have to answer. You're going to answer for all of his surgeries, all for the next 20 years.
Right.
Yeah.
And so I got to make sure that, we have everything aligned so we can manage and take care of these patients.
So what would somebody, and I don't know if you're allowed to talk about this or how that works. Like what should somebody, well, first let me ask this. You're in San Diego, so you're like down in the corner. You couldn't be further from everybody else. It's besides corner of Florida, Washington, and Maine, right? Those are like the furthest way you could be. So are you more helping people on like the West Coast, or are people coming from all over the country? Or do you recommend that somebody, if they're going there all the time, they find somebody in their area of the country? Like, how does that work?
Really good question. We do a lot of zygomatic and pterygoid implants. And there's other offices in California that do them. I don't know. And I can't speak for other offices, but I know, like with Dr. Shrafi, I've been to Dr. Juan Gonzalez's courses and hung out with him and Dr. Sammy and all these guys that are just phenomenal at what they do. And I'm lucky to have a senior partner that does what these guys do. And so I know our capability is I don't want to say second to none, but for our geographic location, It's right where it needs to be. And so we see a lot of people from California, from surrounding states come over. But you have, in Arizona, Dr. Vichy and Dr. Gonzalez in Texas, and all these different states have some real big gurus that if you need that, and not all the patients need that, but if you need that, or if
what about for mentorship though? I'm more referring to like mentorship.
Oh, okay. Mentorship. It's going to be all based on the surgeon you work with. Some of them will take you under the wing and do one-on-one mentorship like we do.
Are you bringing people? Are people coming to New York from New York to come mentor you with you? Or are they staying on the East Coast with how does that work?
They're usually staying on the East Coast, but we do have mentorship programs to where, hey, if someone wants to come out, bring a case, spend a week with us, we'll go start to finish.
Got it.
I recently in December spoke at the American Dental Institute Symposium in Orlando, and from there I've had a couple people from the East Coast come out for single day mentorships for mostly sinus grafts and lifts and opening up sinuses, but generally it's local. It's the organic referring doctors locally that'll come and do the mentorship with us. Yeah.
Got it. So someone should, more than likely if someone wants to fly out and mentor with you guys, they totally can, but more than likely they're going to want to find somebody in their market that they can work with, refer cases to when they can't do them or they get stuck. So now you have that relationship and they're going to actually take care of the patient and do the right thing.
Right.
What are some things to watch out for in mentorship? Like what are some things that people need to think through when they're trying to pick a mentor?
That's a really good question. I think case number and case flow would probably be number one on my list.
So the number of cases they've done and the speed that they're doing it?
Right. And their proficiency, right? And I mean, well as I do, everybody has a course, everybody has a symposium, everybody has a lecture, everybody has a YouTube show.
Yeah.
It's and I'll be honest, it's tough. As an oral surgeon myself, I see all the other oral surgeons doing all these things, and you really have to step back and say, hey, does this bring value? Is this correct principle? What is their track record? Or is this a presentation they put together because they want to go on the lecturing circuit, right? And so, again, I look at who trained them. In surgery, it's especially important, your lineage of who trained who, the number of cases, how often you're doing those cases. Publications are really helpful, but then also the company they hold. Like if they're a standoff doctor and they're getting a lot of flack from other surgeons or they're doing things that are controversial, I stay away from those.
Got it. Okay. And then what, you said that you guys are in a unique position because you're in right on the border of Mexico. So it's really easy to hop across the border. There's tons of people in Mexico who advertise in the States, right?
Yes.
So people do that. Like dental tourism is a real thing, especially when you get into full-arch because it's way cheaper, right? Like it's way cheaper. And they don't, and there's a lot of reasons for that. So what are some things that you've seen around that here's the reason I want to bring this up. I want to educate the doctors so they can speak on it, because as you move away from the border, you start to see less and less dental tourism, but you still see it, right? And so some doctors might only see it once a month or once every quarter or once a year, where you might be seeing it multiple times a week where people are talking about it, right? So what are some like horror stories that you've seen around that? And in Florida, I talked to another doctor in Florida. His whole business is almost redoing dental implants from dental tourism. And we did a whole episode just on that. So I was really curious to your thoughts on that.
It's a great question and it's a hot topic. And you're right. We see it a couple times a week usually. And it's unfortunate. The cases that we see, and again, they're not every case because are some successes out there. We just don't see them. But the failures we see are usually catastrophic. It's both the restorative component and one or multiple implants. We had a case not too long ago that was done 2.5 years ago. We can't identify the implant. It looks off-brand, off-label. So we don't know exactly where the implant is from, like the manufacturer. It's not one
that's strange, right? And that's really strange not to be able to figure out where the implant's from.
Right. Well, and that's also why they can offer it for so low, because, a general dental implant, if you have a good deal, you're paying $150 to $300-$400 per implant. And if they're paying $50 an implant down there, there's a reason. You get what you pay for. And so implants weren't integrated. All the bone that was around the implants was completely shot, and the entire upper and lower arch had to be removed. She had to be put in a denture for 6 months because we had to bone graft everything. And again, with full arch, you got a level bone, you reduce, you do certain things to where a denture doesn't even fit well. And the frustrating thing to the patient and for us as well, she went over there and spent a decent amount of money. Granted, she saved quite a bit, but she's now going to end up spending 3 or 4 times as much to get it fixed and done right than what she paid for the first time. And
how often is it that bad? Like, what percentage would you say of people are going over there and that's happening to them?
Well, I can only speak for the patients that we see. I would say 50% of the patients we see that have gone over. Now, again, we're a complication hub, so they get sent to us. So we'll see a higher percentage. But I would say 50% of the patients we see lose the entire arch.
It's a coin flip. If you're going down there, and again, what I'm trying to do is help these docs that might bump into this once in a while.
Right.
Hey, if the patient's thinking about going to Mexico, it's a coin flip if you're going to come back home with something working. Like, flip a coin, heads or tails. Like, sometimes you might get away with it and it might last, but it also might be, you might be paying double or triple what you would have paid if you would have just stayed in the States.
And the other thing that's frustrating is a lot of these situations initially found by the patient 2-3 weeks after surgery, they have a little bump, swelling, bleeding, something not healing. With good follow-up, that can be taken care of during the recovery.
But you can't go back to Mexico
and that's been what I've noticed is patients go, I just can't get back there every time I need a follow-up. And so they're not getting the follow-up they need. They don't have the access. And that's why these failures are happening. A lot of these things could be mitigated if they just get the follow-up. But I'm sorry, if you show up in my office for a follow-up appointment for work that's done somewhere else, I'm not touching it. I'm not going to own it because legally that's now my responsibility and I'm not going to do it. So
it puts you in a bad spot, right?
Yeah. So the access really sucks for these patients and it's unfortunate.
All right. So this has been really, really good. I learned a lot and it's going to help. This is going to help a lot of people, especially people early on in their journey and figuring this full arch thing out. And I really appreciate you coming on. If someone wants to reach out to you and learn more about what they're doing or what you're doing and learn from you guys or just chat with you, what's the best way to connect?
You can reach us on Instagram. You can shoot us a message. We're at SD_oral_ facial _implant surgery. You can reach me directly, Dr. BDE, Brian David Evans BDE at Instagram. You can also look us up on our website, sdoralsurgery.com. There's a handful of ways to get a hold of us. And, it's cool. Dr. Shrafi and I, we do a lot of training courses on full arch, analog and digital. Coming up next month, I'm lecturing again at the American Dental Institute in Orlando on the 19th. Awesome. I'm doing everything maxillary sinus. And that's one of the things that, again, new practicing docs that are doing full arch, they're not familiar working in and around the sinus. And so I'm spending a full day, how to access the sinus, graft the sinus, close the sinus, put implants in and around the sinus. And so that's a great course. And it's been really helpful for the new docs who just don't spend a lot of time around the sinus.
Well, I appreciate it. I've watched some of your guys' stuff. It's hard for me as a marketing guy to watch it, but dentists love it. They absolutely love it. And you guys really dive in. You don't hold anything back, and you're really leveling up the whole industry. So thank you so much for all you do, and thank you for taking the time to come on today. I really appreciate it.
No problem. I'm happy to help, and I love what you're doing. And I just want to spread the word. There's so much need out there, and we just got to make sure these patients are getting cared for appropriately.
Awesome, man. Thanks so much.
You bet. Thanks.